I'm Alice. Welcome back to Men Health 30, where we don't shy away from the truths about men's health, especially sexual health. Have you ever felt a dull ache in your lower abdomen after relieving yourself? Or sometimes had difficulty urinating, a slight burning sensation but brushed it off, thinking it was nothing? Don't be complacent. That could be an early warning from your prostate, an organ that plays a crucial role in both sexual function and urination in men. And what's more concerning is this. There are habits that may seem harmless, but are silently damaging your prostate every single day without you even realizing it. In this video, I'll point out 3 common masturbation positions that many men use and how these positions can cause microtrauma, blood congestion, and even lead to chronic prostatitis, according to reliable scientific research. The question is, can just one wrong position really affect both your reproductive and urinary health? And is it only men over 50 who need to worry about their prostate, or could it be that you, right now, are already being affected without even knowing? The cold, hard truth in numbers. According to the American Urological Association, if you're a man over 50, there's a 50% chance you've already encountered prostate issues. And it doesn't stop there. By the time you reach 60, 8 out of 10 men will be facing this condition. But what concerns doctors the most isn't just age or underlying health conditions. Around 70% of prostatitis or prostate enlargement cases are not caused by bacteria or genetics. They stem from everyday habits that seem harmless, and one of the most overlooked culprits is masturbation posture. According to a 2021 survey from UCLA Health, nearly 40% of men who sought medical help for urinary problems admitted to masturbating in a posture that puts pressure on the perineum, and almost none of them realized that this habit was the root cause of their condition. Here's the real issue. Some masturbation positions are extremely common, yet they unintentionally apply direct pressure on the perineum, damaging the soft tissue around the prostate. At first, there are no obvious symptoms, but over time, microtraumas accumulate, leading to inflammation, swelling, and serious effects on urination, erection quality, and even sexual satisfaction. So, what exactly are these positions? We've gathered insights from clinical studies, interviews with urology specialists, and real-world clinic data, and below are the top 3 most dangerous masturbation positions that you should absolutely avoid if you want to protect your prostate health. First position, masturbating while sitting on the toilet for too long, silent damage to the prostate. It might sound harmless, but in reality, it's extremely dangerous. Many men have the habit of sitting on the toilet for long periods, phone in hand, and relieving themselves in that very position. But what you may not realize is, this posture puts direct pressure on the perineum, the area that houses the prostate, blood vessels, and critical sexual nerves. When you masturbate while squatting or sitting for too long, the prostate becomes compressed, blood circulation is restricted, and tissue becomes congested. The result? Chronic low-grade inflammation, dull pain in the perineum, and persistent urinary issues, even without infection or bacteria involved. A 2021 study from Harvard University revealed men who sit on the toilet for more than 10 minutes per session have up to a 32% higher risk of developing prostate-related urinary symptoms. Early signs you should pay attention to include a feeling of incomplete urination, weak or frequent stream, pressure or discomfort in the perineal area after ejaculation, a vague, lingering ache without an obvious cause. The most dangerous part? You won't notice anything in a day or 2. But if this becomes a weekly or monthly habit, microdamage will accumulate silently, and by the time symptoms show up clearly, it might already be too late. Second position, lying face down on the bed, using a pillow for friction. A dangerous habit many don't even realize. Sounds familiar? This is one of the most common masturbation positions, especially among teenagers and young men. You lie on your stomach, press your groin against a pillow or mattress, and use friction to reach climax. But what you may not realize is, this position creates intense pressure on the perineum and prostate, an area that's extremely sensitive and easily damaged. Red circle if you do this for more than 15 minutes at a time or repeatedly several times a week. Here's what can happen. The prostate becomes compressed. The surrounding tissues are overstimulated. And over time, microinjuries begin to build up, eventually leading to chronic prostatitis. Bar chart according to a Mayo Clinic survey. 18% of patients with chronic prostatitis had a history of masturbating in the prone position using a pillow for friction. So what's the problem? You don't feel anything unusual right away. But a few hours or even a few days later, your body starts to speak. A dull ache in the lower abdomen. A brief burning sensation while urinating. Discomfort or soreness in the perineal area when sitting too long. Bellhop, these subtle signs are your body's early warning signals, if you're tuned in enough to notice them. Standing tall, clenching tight, and internal damage you can't see. Man standing, it might seem like the safest position, but in reality, it's a hidden threat. Unlike the other two positions, no pillow pressure, no long toilet sitting, standing appears harmless. And that's exactly why many men overlook the risk. But the truth is, standing while masturbating combined with tensing the pelvic floor muscles, the area between the anus and genitals, to reach climax, causes a very different kind of damage from the inside out. Collision: when you clench those deep pelvic muscles to intensify pleasure, blood flow becomes restricted, internal pressure builds up, and the prostate is repeatedly overstimulated without proper recovery. The orgasm may come faster, but the price you pay lingers much longer. Bar chart according to Urology Times. Men who masturbate in a standing position and overcontract their pelvic floor muscles have a 26% higher risk of developing non-bacterial prostatitis compared to those who don't use this position regularly. Warning: here are the early signs you must not ignore. A sharp pain or sting during ejaculation. Pressure or tension in the perineal or anal area, even without constipation. A vague sense of heaviness or discomfort in the pelvic region after masturbation, even though you felt relieved. Crossmark: these are not normal side effects. They're your body's early warnings, telling you that your prostate is under stress, being overstimulated the wrong way, and that if this continues, it could lead to chronic inflammation, sexual dysfunction, and urinary problems. Backhand index pointing right. In summary, these three positions, though common and seemingly harmless, are silently damaging the prostates of millions of men. White heavy checkmark. The good news is, if you understand the risk and make the right changes, your prostate has a real chance to recover. In the next section, I'll show you how to masturbate in a healthier way, how to protect your prostate after ejaculation, and which symptoms mean you should see a urologist immediately. After all these warnings, here's the most important part. You don't have to give up masturbation. You just need to change how you do it and start listening to your body at the right moments. Small blue diamond 1. Don't do it for too long or too often. For men over 45, the safest frequency is 2 to 3 times per week. Each session should be limited to 15 to 20 minutes to avoid pelvic congestion, a leading cause of non-bacterial prostatitis. Small blue diamond 2. Choose relaxing positions, no pressure, no clenching. Lie on your back comfortably, maybe with a pillow under your lower back, or sit in a supported, relaxed position. Avoid completely squatting for long periods, lying face down, or standing while tensing. These put direct pressure on the prostate. Small blue diamond 3. Near climax, relax instead of clenching. As you approach orgasm, breathe steadily and relax your pelvic floor and gluteal muscles. Continuous clenching can lead to pelvic floor dysfunction, ejaculation issues, and increased risk of inflammation. Small blue diamond 4. Clean up and rest afterward. Always wash your genitals and perineal area after ejaculation to avoid infection. If you feel mild pain, a burning sensation when urinating, or tightness in the perineum, stop masturbation for a few days to allow recovery. So, when should you see a doctor? If dull pain lasts more than 2 to 3 days. If you experience symptoms like frequent urination, burning, pain during ejaculation, or heaviness in the pelvic area. Backhand index pointing right, don't delay. Don't self-diagnose. See a urologist as soon as possible. Direct hit, and remember, health isn't just the absence of disease. It's about tuning into your body and stopping small mistakes before they turn into major problems. Sometimes, just one small change in posture or an extra minute of rest after ejaculation is enough to help you maintain your vitality for years to come. You may have thought, masturbation? That's just a private habit. Totally harmless. But remember this. Your body always finds a way to speak up when something starts going wrong. Don't ignore dull aches, light burning, or that vague discomfort after relieving yourself. Because very often, those subtle signs are the earliest warning of something far more serious. A question for you. Have you ever felt something off after masturbating? Drop a comment below. Your story might help someone else recognize an issue they've been silently living with too. And if you found this video helpful, don't forget to hit the like button to help spread reliable health information. Subscribe to the channel so you won't miss upcoming essential topics. Here at Men Health 30, we're committed to sharing practical knowledge about the prostate, male hormones, and sexual health in midlife that no one ever taught us. I'm Alice. Thank you for staying with me today. I'll see you in the next video, where we don't avoid the truth, but face it to better understand our bodies and ourselves every single day.